Welcome to Classical Review. Let's go through the latest papers on minimally invasive procedures and aesthetic medicine for this month of May 2017. So we start off with a study on PRS by Sebastian Kotovhana and colleagues regarding the anatomy of the superior and inferior labial arteries in regards to their impact on safe upper and lower augmentation procedures. The author studied 193 cadaver head specimens and evaluated the distribution pattern of the upper and lower labial arteries. They found that in 78% of cases the artery traveled mainly submucosal, while in 17% of the cases the artery was intramuscular, and only in 2% of the cases was the artery found in the subcutaneous plane. They did found, however, that in the central part of the lip, this percentage was much more variable, and that in 30% of the cases, the artery changed planes in its trajectory on the upper and lower lip. So the conclusions are that one must be very careful when injecting filler material in the central part of the lip, and definitely overall that the safest way to avoid an embolic complication of the filler material is, of course, to use blunt tip cannulas. The next paper is signed by Rod Rorick and colleagues from Dallas, and it's about the facial danger zones and how to safely inject fillers in the face. Now, the title of the paper is, of course, a reference to the very popular book by Brooke Seckel entitled The Facial Danger Zone and How to Avoid Nerve Injury in Facial Plastic Surgery. Of course, in this case, the authors really go through all the areas of the face where fillers may improve appearance and share with us their technique in order to maximize patient safety and minimize possible embolism into an artery or vein. I think the most valuable part of the paper are the general recommendations for safety using fillers in the face, which are, of course, to use small syringes, to use blunt tip cannulas, of course, to do a retrograde injection, and to have available hyaluronidase in case there's a suspicion of possible embolism while applying filler into the face. Of course, also the videos that come with paper are excellent, and they go through all the areas, all the anatomic areas of the face, and how the authors place these fillers, looking to maximize patient safety and avoiding embolization of the filler into a blood vessel. And the next paper appears on the Aesthetic Surgery Journal and is on the durability of 3 different types of hyaluronic acid fillers. It is signed by Adelson da Costa and colleagues from Atlanta, and it's actually quite an interesting study. They injected 24 patients with 3 different types of fillers in the mid-dermis, in the lumbar area, and they performed biopsies on these individuals at day 2, at 3 months, and at 6 months. They evaluated how these fillers performed histologically and what was their resorption rate. They found out that biphasic fillers such as Restylane had the least resorption of only 12%. That monophasic monodensified fillers such as Juvederm had the second least resorption rate of 25%, being statistically similar to biphasic group, and that monophasic polydensified fillers such as Belotero or Astellas have highest resorption rate of up to 62%. So they conclude that biphasic fillers have the highest durability intradermally. Now, the next 5 papers on minimally invasive procedures and aesthetic medicine this month are on fat grafting. And 2 of these studies are on the effect of fat grafting on the appearance of breast cancer, while 3 of them are on how to improve fat retention of your grafts. Now, the first paper is a Spanish paper by Roberto Molto Garcia and colleagues from Valencia, Spain. It's actually a very well carried out study on the experimental section of PRS, where they evaluated the effect of fat grafting on the metastasis on a murine model of breast cancer. So they studied 18 mice and they divided them in 3 groups. In the first group, which consisted of 6 mice, they inoculated the renal capsule with breast cancer cells. In the second group, which also consisted of 6 mice, they inoculated also the renal capsule with breast cancer cells mixed with fat graft cells. And the third group was a negative control group where rats were not inoculated with any material. So only this negative control group survived for the 7-month study period, at which time these animals were sacrificed. And the study found that adding fat grafting to these breast cancer cells did not increase the outcome or produced more metastasis of the breast cancer cells. In fact, the survival rate was similar and there was no statistically significant difference between the survival rate of the mice that had only breast cancer cells with regards to the mice that had breast cancer cells mixed with fat grafting, and it was about 5 months on each of the both groups. So definitely a very important study that shows that even if there are breast cancer cells, for example, in a clinical or in a patient that has had conservative breast surgery for cancer, even if she has again breast cancer cells remaining, fat grafting alone should not alter the outcome or have a poor prognosis or promote the development of a recurrence in these patients. And the next study that evaluates the risk of fat grafting to the breast is on the Aesthetic Surgery Journal, and it was carried out by Francisco Claro and colleagues from Brazil. They assessed the effect of fat grafting on the breast in a murine model. They actually studied 54 breasts on 9 female rats, and they divided these rats into 3 groups. In the first group, they injected the rats with autologous subcutaneous fat. In the second 3 rats, they grafted the breasts with omental fat, and in the third group they did not use fat grafting at all. And the rats were sacrificed at 8 weeks, and they found that histologically there were no differences in the anatomy of the ducts and lobules between each of the groups. And they also studied the expression of different precancerous markers such as estrogen receptors or Ki67, and found also that there were no differences between the rats that were fat grafted and the control group. So they argue and they conclude that fat grafting to the breast does not seem to alter significantly the anatomy of the normal breast ducts and lobules, and that does not initially induce a precancerous state in this study. And the next 3 studies are on fat retention. It is by Mikkel Hurley and colleagues from Copenhagen, Denmark, and it quantifies the long-term retention of excised fat grafts over a period of more than 8 years in 108 patients. So what they did is that they retrospectively reviewed these 108 patients that were operated on for a vestibular schwannoma, and they reconstructed the mastoid cavity with an excised fat graft, which measured on average 18 cc's. What they found out after following these patients for over 8 years was that fat grafts took about 2.2 years to have their resorption rate stabilized, and that overall the retention rate was 50%, finding that there was a difference between the retention rate for males, which was higher than the retention rate for females. Now, these retention rates are very similar to other publications that also found out a 50% retention rate. For example, the Lammer publication by Nolan Karp, Mihai Choi and colleagues studying fat graft retention on the breast, which is also approximately 50%. And it also reminds me of the landmark paper by William Little on the use of excised fat grafts for different contour problems in facial surgery. And the next paper on fat graft retention for this month is on PRS. It's signed by Wayne Morrison and colleagues, and it deals with the use of indomethacin in order to improve fat graft retention. So the authors studied 30 mice in which different grafts were inoculated in the dorsum of these animals, and they sacrificed them at 2, 8, and 12 weeks and studied the results of the graft material. So the animals were inoculated with 4 types of grafts: only lipoaspirate, lipoaspirate plus stromal vascular fraction, lipoaspirate plus indomethacin, and lipoaspirate plus indomethacin plus stromal vascular fraction. So what they found out was that the fat graft retention was 15% for the lipoaspirate group only, was 25% for the lipoaspirate plus stromal vascular fraction group, 28% for the lipoaspirate plus indomethacin group, and 35% for the group that had lipoaspirate plus indomethacin plus stromal vascular fraction. So they conclude that indomethacin has a similar fat retention rate to stromal vascular fraction when added to fat grafts. They argue that this is probably due to the upregulation effect that indomethacin has on adipogenesis, and also on the anti-inflammatory effect of indomethacin, since it's a non-sterile anti-inflammatory drug. Of course, indomethacin is used mainly to treat acute gout attacks, but perhaps we will all be using it as an adjunct in our fat grafting procedures. And the last paper dealing with fat grafting on this month of May is on the Aesthetic Surgery Journal. It's signed by Alessio Caggiati and colleagues from Italy, and they propose a way of obtaining a naturally adipose stromal cell enriched fat graft just by using a barbed multi-hole cannula instead of a blunt multi-hole cannula for harvesting fat grafts. Now, in their study, they compared these 2 types of cannulas, and they harvested fat grafts from 5 women and 2 sides of their abdomen, evaluating through flow cytometry different parameters of the different cells that were harvested with either of these 2 cannulas. They found out that the fat harvested with the barbed cannula had 47% more adipose-derived stromal cells in their high density fraction of the fat graft than the one harvested with the blunt cannula. So this is actually a very interesting technique that may improve the retention rate of fat grafts, because we all know that, of course, a fat graft that is enriched with stromal vascular fracture or adipose-derived stromal cells, of course, has a higher retention rate. So this may be a natural way of obtaining this type of fat graft without having to go through different chemical methods to isolate these cells and then add them to the fat graft material. So congratulations to the authors. This is a very interesting paper. And that's all for the recent studies on minimally invasive procedures and aesthetic medicine for the month of May 2017. And I hope to see you all next month on Plastica Review. Thank you very much.